Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In continuation with the Module 2 Patient Safety, we will study today regulation, accreditation measures and standard treatment guidelines. With the chapter 13, Regulation and Accreditation for Quality of Care and Patient Safety, we would be seeing in the introduction part about the discussions of regulation and accreditation, concept of quality and patient safety, accreditation, certification and licensure procedures. So, what do we find actually as in government institutions and by the government rules? What is by regulations? Regulations to set the basic conditions of healthcare facility must follow to legally operate in the country. Regulations focuses on the setting minimum standards, performing inspections and enforcing compliance, ensuring facilities are publicly accountable. Quality checks or accreditations are optional. A facility chooses to seek them to prove its high technical skills and ability to meet specific high standards for service delivery. It is not mandatory actually to see that accreditation comes. It is an optional, and wherever we find that if we have to increase the capacity of a facility, we need to go for accreditation. Accreditation emphasizes constant learning, self-improvement and better performance and reducing risk for patient. Therefore, we find healthcare institutions do promisingly see that they need to go for accreditation. It is driven by high standards and professional responsibility, encouraging facilities to aim for ongoing excellence. We find the facility needs to go more for taking this responsibility of making their facility more as a high standard. According to a major international group called as Ishikawa, that is the International Society for Quality in Healthcare, accreditation is official public recognition that a healthcare facility meets high standard, confirmed by an independent external review of its performance. So simply putting, regulation is required while accreditation is voluntary. So we need to understand these two terms and make it more clear that what is regulation and what is accreditation. Facilities are encouraged to seek accreditation through benefits and competition in the healthcare market, which is now very important. So understand, make it clear more the concept of quality and patient safety. So quality in medicine is different from quality in other fields, where we don't need to mix it up. Because in the other field, because it is essentially linked to patient safety over here with the primary goals of saving lives of the people. Healthcare accreditation is a formal process that enables the basic structure and procedures of a medical facility. It requires checking how well both management and clinical work are being performed. The accreditation framework involves the entire organization from doctors, surgeons, nurses, lab technicians and even all staff, support staff that are all involved in the hospital facility. So, we cannot ignore any of the entity in the healthcare. The process involves top management and pushes the hospital to constantly improve patient safety, which is the ultimate game of this. Accreditation standards are the official rules that a hospital must follow. An independent group checks if the hospital meets these rules, and if so, the national accreditation body grants an official certificate, which is one a need that a hospital should see for. Accreditation is not a single task. Hospital must continuously keep their systems in order and regularly measure performance. This ongoing effort strengthens the hospital system and provides assurance to patients and stakeholders that the care is safe and of high quality, which essentially makes the hospital more responsible. The main purpose of accreditation is to prevent bad outcomes and keep patient being harmed. So we find that bad outcomes are one which derives the image of the hospital and where the purpose of accreditation is preventing it. You can see here the framework for patient safety which is being stated over here, where we find the inclusion of the people in the organization as per se, the physicians, the nursing staff, the technicians, even the logistic people and even the top management, where we try to seek that accreditation inclusions of people in the entire system, where we find the people in multi-specialty hospitals and although have an inclusion of all those specialists, especially surgeons and people from paramedics also. So what is patient safety? Patient safety is seen as an inseparable part of providing good medical care, where you cannot keep it as a separate entity and you can work on this part. As we have always seen that Institute of Medicine's definition is being more found to be very closer actually to the aspects that we need to study for patient safety. The definition states that it is clearly defined as stopping harm from coming to the patient. In a very simpler line, we say, do no harm to the patient. A safe system in healthcare must prevent errors, stop mistakes before they occur, learn from mistakes, review and understand errors that do harm. Foster a safety culture where we need to see that you need to bridge and improve actually towards the safety culture. Create an environment where all staff and patients are actively involved in safety. There is this agency called as HRQ, which gives a description about patient safety, which means being free from injuries caused by medical care that were accidental or could have been avoided, where we find focus on the near miss event or a sentinel event or even adverse event. There are the specific steps that needs to be taken to lower the risk of bad events during the treatment and accreditation standards that helps hospital to implement them. Patient safety involves established procedures and system designed to protect people from injury, which is due to the poor medical management, where we find lot of integration needs to come up to improve the patient safety in a hospital. Healthcare now focuses more on analyzing the risk, using data to improve procedures and reduce errors, building a strong safety mindset throughout the organization. So all this encompasses to see that the ultimate aim is to avoid negative results. And what does it really results in? Significantly, it reduces the chance of medical problems. A truly positive safety culture requires three things: commitment from leaders, which comes from the top management people, and the healthcare leaders. Strong training program, which emphasizes that an organization is learning from the mistakes, and clear communication among the healthcare employees. The inverted pyramid model, which is very important to see over here, it emphasizes leadership and giving staff power. Power is where we find that they are being empowered actually to speak and to include themselves into the patient safety. The inverted pyramid model also focuses on training and giving important tasks to the frontline staff, the people who are at the sharp end to the patients and who work directly with the patients or are in contact with the patients, very important. Hospitals should recognize staff for safe practices where they need to emphasize to find a recognition which is a strong motivation to the employees. Empower staff to these practices. If at all a staff is finding a difficulty, you need to work to empower such staff. Avoid relying on punishment when mistake occurs. There should not be a blame game or a blame culture actually when a staff identifies that he or she has committed some problem and that has led a problem to the patient or has affected to the patient. So they should not be punished for them. They should not be blamed for them. Either they should be helped to learn from those mistakes or the committed mistakes what they have learned. We find this is a grave problem in our Indian hospitals also. Every occur, we find that it is to be reviewed, immediate corrections need to be done, and they try to prevent actually the reoccurrence, which is one reason actually that if you don't work or if you don't review, always the problem happens. See the inverted pyramid model which is being depicted over here, where we find the patients and the associates or the patient's relative. When they come up at a registration counter. Day-to-day monitoring is done, OPD admissions are done, OPD consultations, discharge certificates and fee collection. So there are so many areas where we find that we need to empower our frontline staff from registration to paramedics, from the nurses to our residential doctors. They are being supported in a lot of the procedure that what do they conduct is for the entire activity they are supporting to the patients, and they are meeting the patients concurrently. Even the consultants who are at the second line actually to give more emphasis on the treatment part and even in the process part when the patients are there, and they are being backed by the top management, that is a CEO or CO or HODs or medical superintendent in the hospital, where we find the empowerment goes from the top management towards the frontline people. What is there need to think about developing a safety culture in the hospital? So quality system and patient safety culture work together and strengthen each other. Whatever we are discussing now is more towards the patient safety culture, imbibing and enriching the culture, which is very important to develop a cultural practice. This collaboration results in patients being more satisfied with their care. The patients will be helped to understand what regular care they are getting, what sort of care is being sought by them, and what resultant activity they are being faced up with. So this will develop a sense of understanding to the patients that they are being a part of the patient safety culture. Emergency Care Research Institute, ECRI, the efforts to management risk and improve quality are now being combined in the healthcare, which is very important to see that this combination really improves the quality. This integration helps organization find better and faster way to constantly ensure safe and high quality patient care, which is very important to emphasize that there should not be any compromise to the patient care. Now we would focus on accreditation, certification and licensure processes. What is accreditation in healthcare? Accreditation is a formal process where a recognized group, usually a private or non-governmental organization, they check a healthcare facility. They confirm that it meets a set of high-level quality standards. Accreditation standards are generally seen at the best possible goals and are designed to encourage the organization to always keep improving. They are one to support the organization. They are one actually to help in the improving process. What is the decision to be made by the accreditation agency? The decision is to accreditate a facility that happens to after a team of experts visit the site periodically, actually, usually every 2 or 3 years for a full evaluation, where you find that they try to help you to develop, actually see you improving. Accreditation is typically a voluntary process. There is no sort of a compulsion for that part. The organization chooses to participate in it, and it is not something that they're forced to do by law, which is never being done, and we find that organization welcome accreditation. What is licensure, and how is being licensure seen as an activity? Licensure is the way a government office gives formal permission for a doctor, for a nurse, or a hospital legally practice or run their business, which is very, very important. These government rules exist to make sure that people and organizations meet the most basic requirements needed to protect the public health and the safety of the people. What does it really keeps us to take it mandatory, and why compare to the previous discussion where now we are focusing more on the mandatory part? Keeping the license is a mandatory ongoing requirement for any healthcare organization to keep operating and treating patients, which makes them more responsible. A person usually gets a license after they successfully pass an exam. It is very equivalent to all the licensure which a government makes for every entity, which can be seen in other industry also. So what it is actually? It is a show proof that they have the right education, they have the right skills, and they have cleared up actually to the government agency that they possess this licensure. They often have to renew this licensure regularly by paying a particular fee and demonstrating that they are being kept up with the skills through an education which is an ongoing, or they have updated themselves with the current needs. It is not that one time that you have completed and you are continuing with that part. A hospital receives its license after a government official visits where it encounters for the accountability. The government official visits and inspects the site to confirm it meets minimum health and safety rules, which are enlisted actually into the list which they have prepared. Next comes the certification. Certification is when an official body, it can be either a government body or a private, which examines the someone or an organization and recognize that they meet specific specialized requirement. Where you find in comparison actually to the licensure, here we try to focus more on those requirements which are mandated actually to fulfill, and the certification will be given. Where certification more emphasis on meeting the requirement with a specificness. While the words accreditation and certification are sometimes mixed up, and we try to interchangeably use those, and we need to see that there is a clear mark differentiation in it. Accreditation generally only applies to organizations like hospitals, but certification can apply to both people and organization. The major difference in accreditation it is only to organization in hospitals, but certification can be applicable to a person and also equally to organizations like hospitals. For doctors and nurses, certification usually means they have completed extra education and training, as what we are trying even to go you for the healthcare quality management course. After completing this, you may find that you have some proven expertise in this specialized medical area and beyond what is required for this basic licensure. So the certification is one where it tries to prove you to give an extra education and training. For example, a physician might get certificate in specialty like obstetrics or gynecology. So we find they complete it and they try to get more basics and ahead to that. When a hospital or a part of a hospital like a laboratory gets certified or a blood bank gets certified, it is typically means that they offer extra services, technology, or even special capabilities. They are not found to be similar and non-certified organization where people try to question on the trust and the credibility of an organization which they come across that they are not certified, which can be even to an individual person that who tries to possess a certification and seeks the certification and completes the requirement can confidently and can put it actually to the trust and the request what a person or an organization puts to an individual person that what is the certification that you possess. The purpose of accreditation could be explained over here. Accreditation is a strong force that drives major improvements in quality. And it is where we find the foundation of quality lies into accreditation. I would like to emphasize that accreditation uses a set of rules and standards and it promotes continuous improvement. If you go with the Juran's triology, you will find the continuous improvement is a part which we find that accreditation fulfills, making the process effective and efficient. Accreditation involves a self-check by the hospital and a review by outside experts, where you need to first complete by your own and then the outside experts will come, which can be seen as an external peer assessment, which you find the people helping you out actually to improve. And hospitals usually use this to measure their performance and create a plan for getting continuously better. better and better. Medical patient care, which is usually seen as a clinical care, and the support functions that are non-clinical care are equally important in these programs. You cannot just keep medical care only in the gamut of accreditation or support services are to be excluded. No, it is not. Medical patient care and support functions, you can call it simply as clinical and non-clinical care, are most important in this program. The hospital needs to take it as a program. The hospital needs to take it as an activity. So you require the entire hospital employees over there, where the doctors, nurses, administrator, the top people, and even your frontline worker, they all work together to provide high quality care that needs to meet the patient needs and fulfillment, which ultimately gives them the satisfaction. Now, we'd like to emphasize more on the global quality control that is called as ISHCA. What it is? Organizations that set standards and approve other parties, that is called as the certifiers, and they themselves check by a global group of people called as International Society for Quality in Healthcare. This International Society for Quality in Healthcare, we call as Ishikawa, is known as the accreditators of accreditators. So it means fine, the people who are accrediting, they are giving accreditation. And what do they help actually? They help make standards similar around the world. Why do we require standards similar around the world? The reason is that we should sail in the same boat and we should try to give the patient, whether the patient comes up with his EHR or EMR, they can be equally treated across the globe. They should not find differentiation into the care which is rendered to them, and the expectation that they keep should be equally met. It is to continuum of the care. Ishikawa runs through an accreditation program such as they review and approve the standards used by national accreditation bodies to ensure they meet a certain quality level. So where they find that they have set a standards and you should try at a national level accreditation body to meet that. What do we have a national accreditation body in our country? Mostly we can see focus on NABH and NQAS. The Ishikawa checks the accreditation process itself, ensuring that the country's accreditation body follow the Ishikawa rules. What are the benefits and what is the history about it? Accredited hospitals provide a high level quality of care and we try to emphasize that it should go for excellence. The hospitals also gain a competitive advantage in the healthcare field. In the current times, we find it is the most benefiting feather that a hospital can add and can get an extra advantage of seeking the patients. The hospital build a community trust in terms of safety and quality of their services, where they can emphasize to the community that they have this safety and quality as a facet. Going into the history of this, the first formal quality standards were there in US, where the minimum standard for hospitals was seen in 1970s. Official US accreditation began with the JCI, that is a Joint Commission on Accreditation of Healthcare, in 1951. The model was later adopted by Canada and Australia, then come to Europe, and globally by the 1990s we find it was adopted across the globe. Today we find many of the countries are taking this, even India is being included into that. So with this we can find in this particular chapter we have seen how regulation is compulsory but accreditation is optional. Accreditation helps hospitals improve their quality, safety and overall services. It builds a system where the work of the doctors or the top management person and even the nurses and all the support staff or even your frontline staff, they are being checked regularly and they improve with the needs actually what the hospital really require, where they find that the patients are really expecting it. So patient safety and quality go hand in hand. You cannot separate these two entities and patient safety can even be seen as a facet of quality. Accreditation supports hospitals in avoiding errors, lowering the risk, and giving them the safer treatment what their patients are expecting. To keep their accreditation, hospital must keep measuring their clinical performances and work on improving it, rather not just taking it as a static activity which is once being seen as. A good safety culture depends on strong leadership, proper and proper training staff, open communication and correcting mistakes instead of blaming teacher. Ishikawa acts as the body that checks and approves other accreditation, where we define that they are being called as accreditators of accreditators. So hospitals within accreditation gain more public trust, they deliver better care and have an advantage over those without it. So now we can see the references that has been used for these chapters. You can focus on this and you can try to bridge a project which helps actually to seek for accreditation on regulations and licensures for your hospitals. So thank you for the day.